external carotid artery is one of the two terminal branches of common carotid artery and supplies the structures external to the head and in front of the neck. The major source of arterial blood supply to the head and neck is done by carotid system of arteries. Carotid system of arteries include the common carotid, external carotid and internal carotid arteries. External carotid artery that supplies face and neck, while the internal carotid artery supplies orbit and brain. These three, that is common carotid, external carotid and internal carotid together forms the carotid system of arteries. Here we will be discussing only about external carotid artery. First we will discuss about the origin of external carotid artery. Here you can see arch of aorta arising from the heart. Arch of aorta on right side, it gives out the brachiocephalic artery, which in turn divides into right subclavian artery and right common carotid artery. But on left side, the arch of aorta directly give rise to the left common carotid artery and left subclavian artery. That means on right side, the right common carotid artery is a branch of brachiocephalic trunk, but on left side, the left common carotid artery is a branch of arch of aorta. Here you can see the common carotid artery bifurcates into internal carotid artery and external carotid artery. The bifurcation of common carotid into external carotid and internal carotid is at the level of upper border of thyroid cartilage or at the level of C3-C4 cervical vertebrae. To summarize, arch of aorta on right side gives rise to brachiocephalic trunk and it divides into right subclavian and right common carotid. Common carotid splits into external carotid artery and internal carotid artery at the level of upper border of thyroid cartilage or at the level of C3-C4 cervical vertebrae. On left side, the arch of aorta directly gives rise to common carotid and subclavian. Common carotid splits into external carotid and internal carotid arteries. The right common carotid artery arises in the neck from brachiocephalic trunk behind the sternoclavicular joint. The left common carotid artery arises in thorax directly from the arch of aorta. It ascends to the back of left sternoclavicular joint and enters the neck. Here we are going to discuss about the branches of external carotid artery. External carotid artery has got 8 branches. It has got 3 branches anteriorly, 1 branch medially, 2 branches posteriorly and has 2 terminal branches. They are superior thyroid, lingual artery, facial artery. They are anterior branches. Medially, ascending pharyngeal artery, posteriorly, occipital artery and posterior auricular artery, and terminally, superficial temporal and maxillary artery. They are the 8 branches of external carotid artery. Let's discuss each branch a little more. First one, the superior thyroid artery. It's a branch at the level of hyoid bone. It supplies larynx and thyroid gland. The second one, the lingual artery. It's a branch at the level of C3 and as the name suggests, it supplies oral floor and tongue. Third one, it is the facial artery. It is the artery a little above the level of lingual artery and it divides into 2 branches, cervical and facial. The cervical has got 4 branches. They are ascending palatine artery, tonsillar branch, submental artery, glandular branches. Then the facial branch has got 2 branches, anterior and superior labial, lateral nasal branch. Then fourth one, ascending pharyngeal artery. It supplies base of skull, anastomosis with anterior and posterior cerebral circulation. Fifth one, occipital artery. It's a branch at the level of posterior belly of digastric and it terminates on scalp over the occipital bone. Sixth one, posterior auricular artery. It is above digastric and stylohyoid, opposite to the styloid process. It supplies scalp and auricle. Then superficial temporal artery, it is the terminal branch. Eighth one, maxillary artery. It is the largest terminal branch and its origin is behind the neck of the mandible. It has got three parts. First part, it is the mandibular part. Second part, pterygoid part. Third part is the pterygopalatine part, and each part has got many other branches. To summarize, external carotid artery is a branch of common carotid artery. It has got 8 branches. Anteriorly, it has 3 branches. They are superior thyroid artery, lingual artery and facial artery. Medially, it has got only one branch, that is ascending pharyngeal artery. Posteriorly, it has 2 branches, occipital and posterior auricular arteries. It has got 2 terminal branches, that is superficial temporal and maxillary artery.